top reasons I decided to not have weight loss surgery 7 years ago, and what's changed since. Weight loss surgery, just like any surgery, comes with inherent risks. Now, they're not common, but they do happen. And back in 2019, I'd already been morbidly obese for most of my life. However, I was still relatively healthy. I was uncomfortable, and I was just starting to experience the first symptoms of sleep apnea. But other than that, I wasn't on any medication. I didn't have any diagnoses. I just didn't want to be fat anymore. So when I started looking into weight loss surgery, because I had an epiphany and I wanted to change my life, I paid close attention to what the possible complications could be. From complications that are seen right after surgery, like leaks, infection, or blood clots. And just in case you don't know, a blood clot is what causes a heart attack in the heart, pulmonary embolism in the lung, and a stroke in the brain. To long-term complications like dumping syndrome, nutritional deficiencies, ulcers, and strictures. A stricture is a narrowing of a tube. The tube in question being your intestines, which that means the space inside gets squeezed so tight that it's hard to swallow, it's painful, and can lead to blockage. Now, when I looked at all of these complications as a 32-year-old that was pretty healthy, who had already been making lifestyle modifications and losing weight on my own during the pre-surgery approval process, I was like, I don't need this. And for a year, I was very successful. I lost close to 100 pounds, and then COVID happened. I don't know if you guys remember 2020. It was a very stressful year. I held on for about the first 6 months of 2020, and then everything just went down from there. While I was in graduate school, there were signs that I was a person who had undiagnosed major depression. But it's during COVID that I experienced full-blown depression, like not being able to get out of bed type of depression. I was in survival mode for the next 3 years after that. Weight loss was not a priority. I was just trying to survive to the next day. Fast forward to 2025. Things are better, but it's already taken its toll on my body. I'm back to the highest weight I've ever been. I'm older at 39. And for the first time in my life last year, I almost lost mobility. Literally could not walk. I was limping for months. Another thing that 32-year-old Izzy did not want to deal with was the nutritional deficiencies that come with whichever surgery you pick. You have surgery, you're gonna have to take pills. Back in 2019, I was a no-pill girly. I didn't have any diagnosis. I was young, okay? And I was just like, not me. Like, I can't see myself having to take a pill every day. 2026, Izzy takes about 4 pills every day for her hypertension, hyperthyroidism, and chronic migraines. So pill taking is not a big deal anymore. I'm not new to this, I'm true to this. So I was just like, you know what? Bring on the vitamins. Bring them on. Last but not least, at the time back then, I was not ready to give up any types of foods. I loved food too much. I was a strong believer in moderation, and even the possibility of me developing any kind of intolerance to any kind of food was a really big deal to me. It was a non-negotiable. I was like, I want to be able to eat whatever I want. I just know that I want it to be in moderation. I don't care anymore. I've lived with pain for too long to hold on to certain types of food. If it means that there are some foods that I can't have anymore, I am willing to do that trade-off. If it means I'm no longer going to be in pain. If it means I can walk easily. If it means I can do more activities, go out with my family and friends. If it means not feeling like a prisoner in my body anymore. I still don't regret not having surgery back in 2019 because that's also around the time where I started taking care of my mental health by seeing a psychiatrist and a therapist. Obesity is a very complex disorder. There are many different facets that need to be managed in order to be successful long term. And I think I would have been very miserable if I had had surgery back then when I didn't learn what I've since learned or gone through what I've gone through. Because now the benefits outweigh the risks. Anything that I'm giving up is not worth everything that I'm going to be gaining. If you ask me, I definitely think that weight loss surgery should not be your first option unless your life is at risk. And unfortunately, that's where I'm at.